Hey kids, this is start of flu season, so on today's Buzz, we're going to discuss everything about influenza. Let's start with a fun fact. The word influenza is from the 1300s. It comes from the Latin word influentia, meaning influence, as ancient doctors thought this disease came from an influence of the stars. The illness was thought to be due to cosmic influences, and I think that's actually quite romantic. Of course, now we know that influenza is caused by the not so romantic influenza virus, which we simply call the flu virus. There are three types of flu, A, B, and C, with A being the worst and causing the worst epidemics and the worst symptoms. B will make you sick, but it's not usually that bad. And C is so mild, I've actually never diagnosed it. And by the way, what people call stomach flu, that's vomiting and diarrhea, is not caused by the flu virus. It's a completely different problem. The flu is passed by respiratory droplets from coughing or sneezing and not covering your mouth when you do so. It also comes from touching contaminated surfaces. So covering the mouth when sneezing and coughing and keeping the hands clean and out of the mouth is important. Incubation period is very short. Once exposed, there's on average about 2 days before symptoms hit. Flu season here in the southern US goes from about October to March, with the worst month being February. And there are regional differences depending on how early spring comes. As far as symptoms, one of the key points is that flu is a very sudden onset. Kids seem to go from healthy to sick in a matter of hours. There's headache, body aches, and muscle aches. Fever and chills are a big part of flu. Fatigue and weakness, these are the major symptoms of flu. Now, cough, runny nose, and scratchy throat, these are less common and are more suggestive of a simple cold. Vomiting and diarrhea are also not very common with flu, except in younger kids. Untreated symptoms usually last about a week, and symptoms are worse in kids that are less than 5 years old and in those children with chronic health problems like heart or lung problems. Often after a flu infection, kids can get bacterial infections like ear infections or sinus infections. But the big concern after flu is bacterial pneumonia, an infection in the lungs. This is because flu makes the airway have a hard time clearing out mucus, and that sets a kid up for strep pneumonia, bacterial infection in the lungs, and that can be very serious. So an important point here, if your child has flu and just can't seem to get over it, or they're getting better from flu and suddenly take a turn for the worse, definitely get them checked out and make sure there isn't one of these bacterial complications present. Other complications include dehydration from not drinking enough, or worsening of chronic lung diseases like asthma. And there are rare complications of flu like brain or heart inflammation, but as I said, these are very rare complications. Again, all of these problems are more likely in young kids or in kids who already have existing health conditions. The flu can look like other viruses like COVID, so we like to do a nasal swab test in the office, a test for both major types of flu, A and B, and it takes about 10 minutes. Treatment of flu is mainly supportive, meaning fluids, rest, and chicken soup. Tylenol or Motrin can be used for pain, but do not use anything containing aspirin. Using aspirin in a child who has flu can put them at risk of Reye syndrome, which is a very serious liver disease. Now, if your child is diagnosed in the first 48 hours of illness, we may be able to use some antivirus medicines, the most common of those being Tamiflu. Tamiflu helps prevent serious complications of flu and can shorten the duration of the illness. The earlier it's used is better, and like I said, it has to be used in the first 48 hours to be effective. So if you think your child has flu, get them checked out right away. Tamiflu can also be used in the healthy contacts of someone with flu to prevent it from spreading within a family. Speaking of prevention, this picture is from 1918 when an estimated 50 million people worldwide died of flu. Yes, 50 million. And over 100 years later, we're still discussing the very same preventive methods. Hand hygiene, keep your hands clean and away from your face. Teach your kids to cover their mouth when sneezing or coughing using the crook of the arm, not their hands. Wipe down contaminated surfaces. Keep your kid out of school. Kids can shed the virus for 10 days, but at least keep them out of school until the fever is gone and they're feeling better. But there is one improvement over 1918. Let's talk about that flu vaccine. If I haven't made it clear yet, flu is a dangerous disease for kids. On average, 200 children a year die of flu in the United States, and 80% of those fatalities have not had a flu shot. Now, the flu shot is not guaranteed to completely keep your child from getting the flu, but it will probably prevent it, and it should make the flu less severe if they do contract it. So I recommend the yearly vaccine for every child 6 months and up. We do have a needle-free nasal vaccine, but the kids have to be at least 2 years old, and they can't have asthma or any immune problems to take this. The shot and the nose spray are about the same effectiveness. Now, here are a couple common and very good questions. Why do we recommend a new flu shot every year, and why does it work better some years than others? Well, the virus mutates every season. It changes what it looks like to fool our immune system, so the vaccine has to be updated every year to keep up. Scientists have to decide which strains to include in the yearly flu vaccine 6 months before the season starts, so they'll have time to make enough flu vaccine by fall. Sometimes the strains they choose for the vaccine are spot on and the shot works really well that year. And sometimes they choose the wrong strains and the vaccine doesn't work well that year. But let me tell you, I've gotten a flu shot every year for over 30 years. I'm exposed to the flu literally hundreds of times a year, and I've never, not once, tested positive for the flu. So take that for what it's worth. One last thing about the flu vaccine. It takes 2 weeks to be effective. Remember we said that flu has about a 2-day incubation period? Your kid is exposed, and then 2 days later they're sick. So you have to get the shot before flu season. The big complaint I hear is, I got the flu shot and it gave me the flu. This does not happen. The flu shot does not cause flu. What happens is someone hears flu is going around their child's class and they say, I better get them a flu shot. And 2 days later, the kid comes down with flu before the shot starts working. Get the shot early as soon as it's available and avoid this problem.
Remember, don't spread germs.
Thanks for watching today. Subscribe and like, and check out our old videos. We've got quite a library now. Remember, we post a new video every Sunday at noon. Y'all know me, I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.